Health outcomes. Changes due to interventions. To bring positive change, patient experiences and health must both improve. Healthcare costs must be lowered, and clinician and staff burnout has to end. But our problems are big. 133 million Americans have at least one chronic disease. 500,000 people are dying every year from hospital errors, injuries, and infection. The shortage of primary care professionals will be as much as 100,000 in just the next 5 years. Big problems require bigger solutions. Positive change needs acceleration. It needs to happen now. But these are not so easy solutions that many don't want to hear, and even few are willing to talk about. How to lead such a change? How to discover, discuss, and disrupt healthcare to make a difference now? This is VITALS, Visionary Health Leadership in Action.
Good afternoon and welcome to VITALS. I'm Dr. John Langell, the president of Northeast Ohio Medical University. We're pleased to bring you VITALS in collaboration with University Hospitals. VITALS is an open forum to hear from today's national leaders who are transforming the healthcare landscape using the VITALS tools: value, innovation, technology, advocacy, leadership, and service. Today, we're honored to welcome Dr. Katie Passaretti to VITALS. Dr. Passaretti is the Vice President and Chief Infection Prevention Officer at Advocate Health. She provides medical leadership for quality improvement in infectious disease and emerging pathogen response across 69 hospitals in 5 different states. She also serves as the Clinical Professor of Internal Medicine in the section of infectious diseases at Atrium Health Wake Forest University School of Medicine. She continues to see patients admitted to the hospital with infectious diseases in addition to her administrative and educational responsibilities. A frequent contributor to both local and national news outlets on infectious disease topics, Dr. Passaretti is passionate about cultivating future leaders, improving community health, and addressing healthcare disparities. Please join me in welcoming Dr. Passaretti to VITALS.
Thank you so much for having me today. Very excited to talk to this esteemed audience. So just a little bit in the way of background, I am an infectious disease clinician at heart that kind of fell into a career in administration, specifically around quality work and infection prevention in healthcare settings. So excited to share some of my journey with y'all. So what I'm going to be talking to y'all today, I titled my slide Scaling Up, and it's really about system-wide infection prevention initiatives, especially during this current era of uncertainty that's impacting our healthcare systems and very specifically impacting people that do work around public health, healthcare epidemiology, and infection prevention. So just a little bit of background. As mentioned, I'm currently the Chief Infection Prevention Officer at Advocate Health. Just for a little bit of context on what that means and what our healthcare system does. So currently, our healthcare system includes 69 hospitals across 5 different states and any number of outpatient sites. We have skilled nursing facilities, rehab facilities, behavioral health. So very broad patient population, which I think just that context is very important as we talk about large system-wide work related to infection prevention. I'm sure many watching this session today are well aware of the growth of large healthcare systems, Advocate Health being one of those. This is a slide that I borrowed from KFF that shows the growth of healthcare systems just between 2010 and 2022. And, system-affiliated healthcare systems have increased from about 55% to almost 70% over the past decade, and that growth is expected to continue with some differences between rural and non-rural sites. So healthcare systems are getting more common, more and more facilities are working in this kind of integrated milieu of our current healthcare environment, which means you have to kind of adapt and address system-related issues in a slightly different way than maybe you would do for an individual facility. And, why is infection prevention particularly important in this environment of ever-enlarging healthcare systems? Healthcare-associated infections are a huge issue in our healthcare settings. And while we've made improvements, there's still opportunities to keep our patients safe within our hospital walls. So just some statistics to kind of level set the work around infection prevention. About 1 in 31 hospitalized patients in the United States every day have a healthcare-associated infection. We have about 2.8 million antimicrobial resistant infections each year. And obviously, as we saw during COVID, post-COVID, are infectious disease threats emerging and re-emerging. Many of us currently at the time of this recording are dealing with an ever-enlarging measles outbreak in the United States, are just getting more complex and unfortunately more frequent, raising the importance of work around keeping our hospitals and keeping our communities safe. When I first started doing infection prevention across a healthcare system, I first started back in 2011 with a healthcare system that at the time was 10 hospitals big. And at that time, it was I went from a single hospital covering infection prevention, doing infectious disease clinical work, to trying to coordinate across systems. Over time, the scope of my role has increased to where we are currently, where it was explained initially. And with that, my approach to integration of infection prevention programs working across healthcare systems has continued to evolve. I'm sharing our current approach within Advocate Health to infection prevention related work up on the screen right now. And, I do think as we all work through integration in healthcare systems, this concept of working together, collaboration, is one that I'll keep coming back to time and time again. So even as different hospitals come together at different points in time, that mindset of one team and one mission working together in a common direction is very important. Initiatives that are on our current kind of strategic plan are making sure that the individuals doing work related to infection prevention are able to grow and develop. So making sure within our department, and this applies outside of infection prevention, that individuals on the team have opportunities to continue to evolve, continue to improve their skill set and improve their leadership opportunities. Infection prevention, as with many other disciplines, especially within the quality world, that I can't emphasize enough the importance of interdisciplinary relationships, working with nursing, physicians, environmental services, everyone from the highest levels of administration to people that are working in the cafeteria. That really team effort is huge. As shown in the earlier slide, scaling the program across the continuum. So that means as we add additional facilities, being able to kind of expand and cover and have that common approach is important, but also the breadth of services offered. So, healthcare systems more and more have a variety of different settings. So making sure that whether it's skilled nursing facilities, acute care, outpatient settings, that the program addresses all of those things. I'm a big believer, and I'll talk about this a little bit later, in the importance of data transparency and integrity really driving programs. And then obviously our most important effort is making sure that we're improving patient outcomes across all types of patients in all settings. So, a mission for me is preventing infections, whether it's in our patients, our visitors, our healthcare workers, or our communities, and with the goal of leading infection prevention and driving innovation within infection prevention. So, I referenced the spectrum of hospital care just there. And, just to put that in a little bit more context, beyond the acute care hospital walls, programs like infection prevention and many quality programs have to be able to expand and protect people wherever healthcare is happening. So facility-based care is what we traditionally think of as part of infection prevention or quality work. but more and more healthcare is pushing into outpatient settings, ambulatory surgery centers, outpatient clinics, infusion centers. And then certainly we've seen the rise of hospital at home and other programs that are providing care really more in community settings. So it's important to kind of keep in mind all these different settings might have slightly different needs with the same core principles of making sure our patients are safe. So what are the barriers that we're all facing, especially in the world of infection prevention? As healthcare systems grow, hospitals or settings may come in with a different set of resources, or, the difference between rural setting, what's accessible in a very rural setting versus a metropolitan setting, certainly is a challenge that healthcare systems have to overcome. In my healthcare system, we have a academic center, Wake Forest University, and then a number of community hospitals. So with that, you have academic cultures, clinical cultures, cultures from different types of hospitals. So bringing those cultural differences together is often not a barrier, I would say, but an opportunity to kind of work on those collaborative skills. As systems get larger, variability in buy-in or accountability infrastructure may impact program development. And then, you're starting out newly coming together. There's a patchwork of different policies, patchwork of where people are when they're coming together, that, getting people up to the same level, meeting collaboratively is definitely a bit of a process. The additional realities that we're dealing with currently, and this is particular to the infection prevention world, in our current federal environment, we are facing potential loss of external expert guidance with groups like the CDC and the Healthcare Infection Control Practices Advisory Committee that's recently been done away with. So this may mean that healthcare systems have to kind of step up and provide some of that expert guidance around issues related to infectious disease, especially within large healthcare systems. And, it may pose additional strains on internal operations. The other thing I'd be remiss to mention, certainly vaccines are hugely important to efforts related to infection prevention, whether it's in our healthcare settings or out in our communities. So challenges to vaccine uptake and the vaccination infrastructure may mean increasing outbreaks that healthcare systems have to deal with. So, it's not making life easier within the world of infection prevention, and certainly, means that we maybe need to think about how we do things in a slightly different way across a slightly broader footprint, especially for large healthcare systems. Approaches to health system infection prevention. So, a couple of core components that I found to be very essential. So that leadership commitment and transparency is really important at all levels. That means from the CEO down to the tiny facility, nurse manager. That leadership commitment to the work and knowledge of outcomes is very important in making sure we're doing a good job of conveying those outcomes. Standardized core protocols. So there are certain things that should be a given within healthcare settings while allowing for adaptability for those things that need some flexibility for local adaptation and implementation. Of course, we're all in continuous evolution, so that continuous monitoring as time goes on is hugely important. And then, we never do anything perfectly, so those rapid feedback loops and PDSAs are essential. So that constant process of, identify your highest priorities, evaluate how the work is going, change as needed, adapt as needed, is very important, especially as our kind of environment around us is changing slightly as well. I am, as I mentioned a little bit ago, a big believer in data transparency and data being important in driving accountability, driving improvement in outcomes. I put a couple of screenshots of some of the different dashboards that are in my system specific to infection prevention that are used to help with that effort, to leverage data and dashboards for awareness to help continue to drive improvement, perhaps that sense of competition between facilities that want to kind of continue to improve performance. And I think it's important for outcome measures and also the process measures that we know will move the bar on those outcomes. The other thing I want to mention as a key component of, especially system infection prevention work, more and more, even within quality and infection prevention, there's opportunities for telehealth and remote consultation. Like in small rural hospitals, we might not have infectious disease doctors. We might need to leverage those telehealth opportunities similar to how we do for clinical care to make sure those settings have access to the resources that a large setting would have. As with everywhere in the world right now, leveraging machine learning and AI is essential on the research front, as well as on the, how do we provide care? How do we provide information, education more efficiently? And I think machine learning and AI are key tools that we will continue to learn how to leverage and use effectively. Within the healthcare system, shared electronic health records are huge for being able to have kind of standard practice and work across areas. And then shared data tools are another component. So bridging those gaps with technology, I think, is an area that we're continuing to explore, even within infection prevention quality work in large healthcare systems. And this is just one example of kind of data transparency. This is some Pareto charts that identify shared opportunities, so data across our system. This is specific to central line associated bloodstream infections, and can see it allows us to leverage the strength of those 69 hospitals. Where do we put our effort? Where is the biggest yield, where we have the most opportunities to try to improve infection? So again, just that transparency of data kind of from stem to stern can help drive improvement in patient outcomes. So I talked about several barriers. How is my healthcare system closing some of the gaps? The cultural barrier that I mentioned previously, certainly can be challenging and take time to build relationships, but fostering champions and celebrating successes certainly is a key component to ensuring that we're working together as a team. Standardizing messaging and the data sharing that I've mentioned are hugely important so that everyone's hearing the same thing. We don't have pockets of disconnected voices. And then, I work in infection prevention, infectious diseases. We aren't doing surgeries, bringing tons of money in. So, looking at our outcome data and making the business case for why this work is important, return on investment from reduced infections in my case, or whatever value-based purchasing impact, that is important in a reality that, especially in large healthcare systems, that is worth considering and addressing. So, how do we go from individual hospitals to a large healthcare system approach within the world of infection prevention? And, starting out when you're in an individual facility, individual facilities coming together, there may be inconsistent policies, duplication of efforts that may drain resources, cause redundancy. Missed opportunities to scale what's really working in a setting that hasn't been kind of shared between settings. And then, we may have variability in outcomes by zip code, by location, moving to the potential of what can happen when a system is working together. So those shared dashboards allow for faster detection and action. Scalable best practices can help reduce harm and cost. Standardization, where it makes sense, allows for onboarding in a consistent way, audits and education. And then, system-wide partnerships with public health and supply chain can make on the supply chain side, big financial impact, and on the public health side, a big community impact. And, this really does matter to leadership, from the CEO to the CMO. Value-based purchasing, enterprise-wide visibility means smarter decision-making. We can potentially have leaner teams using some central support, whether in the infection prevention world, it's centralized surveillance, centralized data analytics, and then, impacting national reputation and resiliency of the team. So, what's the next chapter in our work around system infection prevention? Certainly continuing to work within the healthcare system, but I do believe beyond the healthcare system, there's opportunity to impact the community and deepen that community impact, whether it's through collaboration with our public health and community partners, working with population health within our systems, working on vaccine equity and outbreak readiness, or working on social drivers of infection. There's also opportunities to build synergy across initiatives. And again, some of that is leveraging shared tools and dashboards, embedding clinical pathways into care, and working across disciplines. And then finally, the key component that I haven't talked about is how to sustain that, right? Often when hospitals come together, there's a lot of energy at first and excitement, and that can peter out over time. So making sure we're sustaining those efforts by learning within our teams and educating outside of our teams and continuing to work on that in a culture of continuous improvement. So, I do believe the future of infection prevention is coordinated, collaborative, and community-driven. Together, health hospitals and merging healthcare systems through unified goals, scalable solutions, through data, and through interdisciplinary accountability, I think can bring us all better patient outcomes and healthier communities, and leave behind some of the stuff that we don't want to take forward, whether it's siloing of efforts, being reactive rather than proactive, or issues with burnout with our teams on both the infection prevention side and the clinician side. So many voices, one mission. I've kind of talked about a lot of these over the course of the past 15 minutes, but I think these kind of core elements continue to be important, and they honestly spread beyond infection prevention efforts to any kind of healthcare system integration. The importance of that shared vision, system-wide standards, that data transparency, leveraging technology so we work smarter, not harder, and that empowerment of all levels. And that commitment to evaluate if what we're doing is working, and then, pivot as needed to make sure that we're continuing to level up and improve on patient care. So, I think there's a lot of potential within the world of infection prevention, within the world of quality, with bringing hospitals together, whether it's academic, clinical, to work together as one and leverage the strengths of different settings. And, I think we're at Advocate Health on that journey, and I think many others as well. So I have a lot of hope for the future that we can continue to move forward together and impact our patients and our community, and make both safer. So that is the end of what I was going to say with you. I am going to go ahead and transition to Q&A, so we can take a couple of questions.
Thank you so much for sharing lots of valuable information. I mean, infectious disease is so important and critical to patient outcomes and also staff safety, like you mentioned. So definitely an important, sometimes overlooked area in the healthcare system. But I want to introduce myself. My name's Cheryl Powell. I am the executive editor of the Akron Beacon Journal in Akron, Ohio. And I also, before becoming an editor and moving into the management field, I was a reporter and spent 15 years of my career covering, as a medical writer, covering the healthcare industry, the business side, as well as some feature stories and even some outbreaks like the old H1N1 when that first came around. So this is a passion area of mine. So appreciate you taking the time to answer a few questions. First, you've been in this career and probably seen a lot of changes. So, could you talk a little bit about how your approach to patient care has evolved over your career, particularly in light of, the constantly evolving infectious disease threats?
Yeah, so ID in really many clinical fields, you have to continue learning and growing as you're going. So my clinical knowledge, you can't just rest on what I was trained in medical school. As with anyone, that constant commitment to learning and being humble enough to take on that new knowledge, I think is super important. I started as a infectious disease clinician, just taking care of patients, and certainly have evolved from that. Okay, I'm dealing with one patient here at the bedside, to how do I instead work across hospitals, across a number of patients? So moving from that single patient to population certainly has evolved my way of thinking. And then, in infection, I didn't go into ID intending to go into infection prevention, but, certainly that reacting to a clinical scenario versus being proactive in that preventive state has been an evolution for me. Like, how do I prevent things instead of reacting to things? And even within my infection prevention career, going from reacting to an outbreak to how do I put the things in place to prevent that from happening in the future? So, I think those are some of the big shifts that have happened over the course of my career, and, hopefully will continue to grow over time.
Now, in your role, you're over a large system, obviously. So how do you look at that? And there's probably different communities, different sizes, different patient populations that you're serving. So how do you go about tailoring those infectious disease prevention strategies, to address specific vulnerabilities that may be different in different patient populations?
Yeah, I think doctors at some level have to be able to tailor your messaging to different populations, like being able to talk to in clinical lingo when I need to, and then breaking it down at a level that's understandable and, meaningful to patients is important. And that, even more so when you're communicating to, say, a community audience or talking with the media or that kind of stuff. So that ability to talk both, hang in with the clinical people and then hang with the community and be able to be meaningful in both settings is certainly important. And, that applies across vulnerable populations, right? So how I talk to a university audience may not be the same as if I go to a church in the middle of rural North Carolina. The messaging slightly different, the phrasing slightly different. So just being able to adapt, I think how you're communicating is just hugely important. And, I think avoiding that that tendency to be like, well, this is clearly what you should do, right? Like, obviously you should get vaccinated, or obviously you should do XYZ. Like, understanding where people are coming from and going in with the intent to listen and not just talk at whatever that setting is, I do think is very important. And, honestly, during COVID, especially in the world of public health, infectious diseases, a lot of trust was lost in some communities more than others between healthcare and the community. So rebuilding that trust and actually listening and, taking the time to like truly hear and have that conversation with either an individual level or a larger setting level is very important.
Talking about communicating and addressing people's concerns, you had mentioned the measles outbreak that's happening now, and obviously a part of that has to do with vaccine resistance. Um, how do you address that, and how do you, without being seen as, lecturing people, how do you address that, and what advice would you give to clinicians to try to address that?
Yeah, vaccine hesitancy is one of the most challenging things that came during COVID and unfortunately has persisted. You would think coming out of a pandemic, we would be like, whoo, vaccines, and that is not where we ended up. So,
Mhm.
I wish I had the magic answer. I do think that coming from a place of hearing your patients and having an iterative discussion, like if you come at them and be like, get vaccinated, it's ridiculous that you're not getting vaccinated, like nobody, your kids don't respond well to that, like your patients don't respond well to that. So making sure that you're having a discussion, that you talk about it and then talk about it again. I do think, social behavior impacts that, right? So talking to key leaders in different communities, and if you get them on board, I think there's often impact to others in that setting. So I think there's no one answer that fits all the time. And unfortunately, it's much harder than it's ever been to do that. And it takes more time, but so worth it when you know that you have a patient that's healthier or a kid that's now protected against measles, whereas they wouldn't have been before.
And you spoke about, in your own career, the importance of continuous learning, and that's obviously in medicine. So how do you, as a leader, how do you foster that type of environment and culture of continuous learning within your teams and across the healthcare organization?
Yeah, I do. I'm a empathic and vulnerable leader, for better or worse. I do think that vulnerability and transparency, like that, I also am learning along the way, like, being able to lead, but also being humble enough if there is new information. I mean, we learned this a zillion times during COVID, right? We knew nothing and we learned along the way. And I think if you say, I have all the answers and I clearly know what we're going to do, and then something changes, and that's when people don't trust you. So being like, there are still things I don't know. I'm working to, as we learn more, I'm going to update you, and I'm committed to doing that. Here's what I know now. And what I'm committed to do is making sure that you, my teammate, my patient, my community are as safe as possible. And as we know more, we're going to have, I think that upfront messaging makes a difference, and, and is super important as we kind of grow. So, messaging that I don't know everything is important to me. I am good at what I do and I will answer to the best of my knowledge, but, there are things that are evolving and we're going to both learn together. And, and I think giving people the opportunity to learn on your team or ask questions, and not, answer that from a place of, I want you to learn, not like, well, you clearly should know, that is super important. The way you answer questions and communicate is important as well.
Do you think that was one that admitting we don't know everything, was that one downfall or during the COVID initial stages of the COVID-19 that do you think it has broken that relationship and that trust? Because people were hearing, you don't need a mask. Yes, wear the mask. How long do you wear the mask? Or this take the shot and you're not going to get COVID. Well, you might get it, but not as bad. I mean, do you think that was a lesson learned?
Oh, I definitely think we learned a lot. I mean, probably even more about communication than the
Oh,
science during the pandemic. 100% that, like, being transparent about what we know and we don't know, and that thing may change. And, like the masking debacle early on, where we didn't have enough masks. So the message to the community was, let our healthcare workers mask that are in the thick of it, and y'all don't worry for right now. And that was absolutely the right thing to do. It was messaged horribly, and that became like, a main point of like why, people don't know what they're doing or giving inconsistent messaging. So, I think the rationale and the acknowledgement that we're still learning and things may change, but this is what we know right now, and the way to keep you safe with what we know right now, we missed that opportunity, and it really backfired.
speaking of learning, if we could talk to the students, future physicians, what advice would you have for them to be effective advocates for their patients and for the communities that they're serving?
Yeah, I think, some is what we already kind of talked about, like communication, the skills to communicate at different levels are just hugely important. I think not being afraid to use your voice, even whether you're a learner or in a leadership level, I think your voice can be impactful, and, learning how to use that effectively is a great skill to have early on. I would say, I went in to medicine intending to be a clinician, primary clinician, for my whole life, and ended up in this administrative pathway. So I would also say, be open to different doors that open to you that may allow you to leverage your voice in different ways. And if you choose your voice to be one patient at a time, that's amazingly impactful and meaningful. And it also could be impactful and meaningful if you decide to, veer into a different path and you use your voice in a different way. take the time to learn the skills to do that most effectively early on, so that you can make the biggest impact.
Also speaking to students, our pharmacy students, what advice would you have for pharmacy students who are maybe interested in the role of, getting involved in infectious disease? And can you talk a little bit about the role of the pharmacist as part of your team?
Yeah, so I would say, infection prevention, antibiotic stewardship, pharmacists are hugely important. Infection preventionists, nurses, MPH individuals that have an MPH, med techs. Those people are probably, frankly, more important than I am in getting the message out to units, in doing the work that we do every day. So couldn't brag more on either of those groups. I think, people that go into infection prevention and pharmacy or antibiotic stewardship tend to like details. And sometimes people's eyes glaze over a little bit when you're like way in the nuance of the details. So, think about elevating the message. What are your main messages that you want to convey to be impactful versus like, I had 2.5 blah, blah, blah per blah, blah, blah. That information is not meaningful. So, make your message meaningful and use the data to support that rather than vice versa.
We talked a little bit about AI and the role of AI as it's evolving in healthcare in general, but specifically for infectious disease tracking. Can you talk about how AI is performing and the possibilities as far as integrating it for environmental, genomic, and clinical data?
AI is super exciting in a number of fields and super scary, right? Like tons of potential and tons of like fear around how to use it wisely. I think there are lots of opportunities if we can figure out to harness it effectively to have smoother workflows, offload some of the data things that we spend much time doing. So I think it's a huge tool to work smarter and to be leveraged for the future. As you mentioned, kind of genomic surveillance, large data sets, so much faster than any human being, regardless of skill set, can do. So I think huge opportunity to help on the data front moving forward within the infection prevention world. Potential for some of the surveillance that's done for hospital-acquired infections to be done by AI type algorithms and tools to save people time to actually be out rounding and doing the things that people do very well. I do think there's a lot of potential. We're not there quite yet, but I have a lot of hope for the future. And I think embracing the tools early is the smart thing to do.
One more question I wanted to ask you. In your field, what emerging threat keeps you up at night?
Yeah, I think, we touched on vaccine challenges, and that crosses so many different issues. Like, it scares me hugely. I believe we will have another pandemic. I don't know whether it'll be in 10 years or 100 years, but going into that with our current state of trust in science and vaccines and, the measles outbreak. Did I think I would be dealing with measles potentially becoming endemic in my career time? No, pertussis is going through the roof. So I think rather than a disease process or something that that hesitancy around vaccines, which are such amazing tools, is just incredibly troubling, and I think opens a Pandora's box of infectious disease threats that we're not using a primary tool to prevent. So I think that's the thing that scares me the most.
Well, thank you, Doctor, for taking the time to share a lot of great information and answer our questions. And now we're going to send it back to Dr. Langell. Thank you.
Thank you.
Thank you, Dr. Passaretti, and thank you to all who have joined us today. Please join us next month when we hear from another outstanding leader who is transforming the healthcare landscape.
Health outcomes. Changes due to interventions. To bring positive change, patient experiences and health must both improve. Healthcare costs must be lowered, and clinician and staff burnout has to end. But our problems are big. 133 million Americans have at least one chronic disease. 500,000 people are dying every year from hospital errors, injuries, and infection. The shortage of primary care professionals will be as much as 100,000 in just the next 5 years. Big problems require bigger solutions. Positive change needs acceleration. It needs to happen now. But these are not so easy solutions that many don't want to hear, and even few are willing to talk about. How to lead such a change? How to discover, discuss, and disrupt healthcare to make a difference now? This is VITALS, Visionary Health Leadership in Action.